Question number 1. The nurse has conducted discharge staging for a client who had fenestration procedure for the treatment of otosclerosis. Which of the following, if stated by the client, would indicate that teaching was effective? Options. Option A. I should drink liquids through a straw for the next 2 to 3 weeks. B. It's okay to take a shower and wash my hair. C. I will take stool softeners as prescribed by my doctor. D. I can resume my tennis lessons starting next week. So before going to the correct answer, let's see what is meant by fenestration operation. Okay. So in fenestration operation, that is helping to improve that hearing activity, because during the person is having diagnosed otosclerosis, they having chance to get loss of hearing. Okay. So we are trying to regain the hearing by the fenestration procedure, by the creation of new window into the labyrinth, okay, to take place of the oval window which has become occluded by the otosclerotic bone proliferation. Okay. So here the correct answer is option C. I will take stool softeners as prescribed by my doctor. Okay. So following the ear surgery, the client need to avoid straining while having a bowel movement. Okay. Let me see other options. The client need to be instructed to avoid drinking through a straw for 2 to 3 weeks, air travel, and coughing excessively. And the client also need to avoid hair washing or showering for 1 week, and other rapid movement of the head like bouncing, bending over 2 to 3 weeks, the client need to avoid it. Okay. So these all activities causes increase the pressure on the ear, and that pressure may dislodge the nerve window, okay, that is placed by the surgery. Question number 2. Which intervention should the nurse implement when caring for a client diagnosed with pneumocystis carinae pneumonia related to acute immunodeficiency syndrome, who is crying over the loss of friends and family members because they will not talk to him anymore? Options. Option A. Advising the client not to worry and telling him everything will be alright. B. Asking the healthcare provider for his psychiatric consult to assess the client's mental functioning. C. Sitting down and listening to the client's concerns and frustrations. And D. Telling the client that the friends probably were not true friends anyway. Okay. So here the correct answer is option C. Sitting down and listening to the client's concerns and frustrations. Okay. So crying is the evidence that the client is being to express concerns to the nurse. Okay. So in response, active, not judgmental listening would most appropriate because it aids in the development of trusting relationship between the nurse and the patient. Okay. And the nurse advising the client not to worry or saying that everything will be alright. Okay. It provides false reassurance to the client. Okay. So which does not help the client to cope up with the current situation. Okay. So if it is required any further assessment, okay, so the nurse to determine that whether it is psychiatric consult is required for the nurse or required for the patient or not. Okay. If it is required, the nurse should be considered about that, and the nurse need to tell the client that the friends were not true friends, discounts the client's feeling and hinders the development of therapeutic relationship. Question number 3. An 18-year-old student is admitted with dark urine, fever and flank pain. He is diagnosed with acute glomerulonephritis, which would most likely be in this student's health history. Options. Option A. Renal calculi. B. Renal trauma. C. Recent sore throat. D. Family history of acute glomerulonephritis. Okay. So here the correct answer is recent sore throat. Option C. So here the most common form of acute glomerulonephritis, that is caused by group A beta hemolytic streptococcal infection elsewhere in the body. Okay. So here the patient is having sore throat. Okay. Already patient is having sore throat. This sore throat is mainly caused by group A beta hemolytic streptococcal, okay, bacteria. Okay. So due to that, so that is the reason that the client is chance to get acute glomerulonephritis. Okay. So if you are seeing other options that were inappropriate for this question. Question number 4. Gold sodium thiomalate is prescribed to a client with rheumatoid arthritis. Which of the following side effects indicate an overdose of the medication? Options A. Flushing, B. Dizziness, C. Joint pain, and D. Metallic taste. So here the correct answer is option D. Metallic taste. Okay. So gold sodium thiomalate toxicity is signs, okay, including pruritus, diarrhea, dermatitis, stomatitis, and metallic taste. Okay. So if you are seeing other options, option A and B, okay, flushing and dizziness, okay, that are the side effects that may occur soon after the injection. Okay. And if you're saying option C, there is joint pain, so increased joint pain that may occur 1 to 2 days after the injection is present for the patient. So the most appropriate answer is option D, metallic taste. Question number 5. In preparation for cataract surgery, the nurse is to administer prescribed eye drops. The nurse reviews the precision orders expecting which type of eye drops to be instilled. Options: option A, an osmotic diuretic, B, a miotic agent, C, a mydriatic medication, and D, a thiazide diuretic. Okay. So here the correct answer is option C, a mydriatic medication. So there is mydriatic medication that produce mydriasis, okay, or dilation of the pupil. Mydriatic medications that are mainly used preoperatively in the cataract client. Okay, so for this is mainly used for the dilating of the pupils. Okay, so this is also helping to constrict the blood vessels. Okay, so let me see the other options. Okay, so option A, that is an osmotic diuretic. Okay, so the osmotic diuretics that is mainly used to decrease intraocular pressure. And if you're seeing other option, that is the option B, a miotic agent. Okay, so this the miotic medications that is helping to constrict the pupil. Okay, not the dilating the pupil. And if you're seeing the option D, a thiazide diuretic, okay, so the thiazide diuretic that is not likely to be prescribed for the client with cataract. Okay, so here the most appropriate answer is option C, a mydriatic medication.